This leg, it feels light.
Hi.
Hello.
We're here visit number 2.
Yes.
Tell me how you do.
I felt a lot better. I was sleeping really good last night.
Okay.
I usually don't get sleep. I hardly get any sleep because of my neck. I have a lot of problem with my neck, and so is my hip and knee.
Right.
Last night, my hip and knee, I was still have the pain, but actually my neck, I was having.
So the neck felt better.
Yeah, the neck felt a lot better.
Was there any change in the low back or hip?
Yes.
Okay.
The lower back,
Okay.
yeah, it felt a lot better. I could stand more than 3 minutes.
Okay.
Usually when I stand, I was having so much pain on my lower back.
So you can stand now for how many minutes?
More than 5 minutes.
Okay. And then I gave you a pedal machine.
Yes,
the
I was
pedal.
I was doing that, and I did it this morning before I left.
Okay.
And it was pretty good.
Okay.
You know, last night I was doing it before I went to bed,
Okay.
and then I woke up this morning and I
Okay.
did it again.
This is good.
Yeah.
Now, we're going to add one other variable with this LAR machine. One of the best rehabs for the knee that Dr. Gonstead used to give his patients back in the 50s
Okay.
and 60s was pedaling backwards.
Okay. Yeah, I
And
was doing
you're
the
doing
front
that.
and the back. Yeah.
Okay, so what we're going to start today, you'll do what's called a 2-to-1 ratio.
Okay.
So for every 5 or 10, let's say 10 minutes forward, 5 minutes backwards.
Okay.
Now the backward, no resistance, we just want the movement.
Okay.
And the idea with the reverse bicycle is it helps reset the Q angle, because when we're looking at the knee joint is composed of what? The tibia and the femur, right? Let me grab the knee model. Let me show you what I'm talking about. So if we look at the knee model, this is representing the right knee, okay? This is the tibia, this is the fibula, the bone on the outside, this is the femur, and then we have the patella.
Okay.
Now, for proper alignment of the knee, we need proper alignment of the knee. We need the tibia and the femur to be in proper alignment so that the patella has good tracking. If we have misalignment of the femur, we have tracking that's off. If we have misalignment of the tibia, we have tracking that's off. And over time, you get more wear and tear, which leads to degeneration. Now, someone who's had an injury on the knee, we're comparing both knees. So we're sending you for an AP comparative standing x-ray, and then the lateral to make sure there's nothing in the back, no Baker cyst or flabella or anything like that, any anomaly in the back of the knee. Okay?
All right.
And okay, so we're doing good. And I also had you wear some socks.
Yes. And I wore the socks that you gave me yesterday.
Yes.
And I slept with it.
I
this
see you liked them
morning.
so much you
Yeah.
got a pair. Okay,
Yes.
sounds good. Shall we get started?
Yeah, sure.
All right, let's do it. Where are you originally from?
Samoan.
Samoan.
Yes.
Nice. And how long you grew up in Seattle?
No, I was actually, I grew up in Samoa. I was born and raised there,
Okay.
but I came to America when I was 18
Okay.
or 16, yeah.
Came for the American dream,
Yes.
like all of us.
But
We all came here for the American
Yes.
dream. I came here, I was a year and a half old.
oh,
All right, so
I'm
starting
American.
at the base of the neck, let's see what we got today. So we worked on her ASR yesterday, C1. We got a tiny bit up top today, 5 points. Hold on, watch this. So it looks like it's breaking there, but it goes up still and shifts over to the right. So we still have a couple of points on that ASR. T2, much better. Tiny bit. We're going to continue on. And the idea is hopefully we're not jumping around too many segments with you. We're sticking to the main ones. Okay. And hopefully today I can go a little bit more today for you. Nice. Alrighty. How are the girls?
Yeah, they're good.
They enjoying their first day, second day here?
Mm-hmm.
Good.
No, we actually got here last week, Thursday.
Oh, okay.
And then we just drove around, went down to Huntington Beach
Yeah.
on the weekend, yeah. And I
5
went to give some flowers for my daughter that passed away 20 years ago.
Oh, wow.
29 years ago.
God rest her soul, man. Now, same 3 spots, okay? T9, 10 area, we had a little bit of pressure there that cleared up. Today there was a little flutter, but we're not messing with it, okay? We're gonna continue on. Let's go back slowly towards me. That's L5. That's S1. That's S2. And that's S3. That's
2.
Yeah. So this is where we were at yesterday, but compared to yesterday, there's a lot more movement.
Yeah.
Yeah. T2, S2, 3. Sit back for me, please, dear. And I'm going to be grabbing a little bit of the hair. Okay?
Yeah.
7, 1, 2. Maybe one day I'll visit Samoa. One day. Much better.
Yeah.
There, but much better. T2.
Okay.
T2. And tiny bit on C1. Okay? So we're going to continue. We're going to do C1 on the right. We're going to do T2 on the left. We're going to go there, do the sacrum.
Okay.
Then I'm going to have you walk. I am going to start tuning up the ankles today. Okay?
Thank
You got it. ASR. So coming down from the mastoid, sliding forward in front of the SCM, right on the C1. Right there. Okay? And now we just want to get that locked out nicely for you. Good.
Oh.
And that's a home run, baby. Beautiful. Wait a second. Deep breathing, please. Muy bueno. Deep breathing. Beautiful. Sit back for me. Now T2 in the chair, left side. So, for the upper thoracics, we need to come down on the joint, right? Because the angle of the disc is slightly superior to inferior. We still want to lift, but the lift is a little different. You're going down into the joint and lifting up. It's very, very subtle. 1, 2. You okay, man? Okay. Now, right there. Bring the shoulders back, please. There you go. The other thing is you really have to open up that chest. So bring those shoulders back. Good. Relax them down. Good. There we go. And we just want to come home run. Nice and easy. So today there was less crackly sounds. It was more specific, less crunchy, less scar tissue. Okay?
Okay.
Good. Stand up and walk, please. Now the fun one. Hold on 1 second here. Let's walk a little bit. 2 times, back and forth. Good. Okay, my dear, come over here now, please. Face down. You remember how we have to do this?
Yes.
Okay, so you're going to just step forward. Hold my hand. There you go. Awesome. And then I'm going to call your other toe close, okay? Slide up, my dear. 1, 2, 3. There you go. Okay, my dear. Yes, 3. Now remember, we got to torque it a little bit. Good. Good. Oh, gotcha. All good. Thank you. That's a home run, lady. Good stuff. Fantastic. As soon as it goes up, you're going to step either side or back. I got you, don't worry. Never mind, you know better.
I know better not to
You know
fall.
better. You've been through this a couple of times,
Yes.
huh?
Yes, I do.
Let's walk it off, please. Good stuff. Have a seat, please. Good. And let's take a nice deep breath. I'll take that. You do realize you're here, right? You told me you've been waiting 2 years to come.
Yes.
You do know you're here, right?
Yeah.
Okay, just making sure. You know you're here.
I'm just letting it grow.
Okay. Sounds good. T2 is clear. So what is clear?
Yeah, I wasted too much money on the
On what?
coloring my hair.
What do you mean? You wasted too much money coloring your hair?
Yeah, just let my white hair grow.
Okay. You're all clear there. Now, let's feel back slowly towards me. All the way back. Muy bueno.
Nice.
All the way back. Nice. All the way
Nice.
back. Bam!
Yes.
I like it. Ears. No more ears.
No more ears.
That's done. Shoulder. Oh!
Ooh.
Woo! That was fun. Now, we're going to start on your ankles today, okay?
Okay.
More pain when I push on the inside here or on the back side?
On the inside.
On the inside here?
Yes.
Okay. How about on the inside here?
Yeah, the inside.
More
Ouch.
right there.
Yes.
So both sides. But here's what we need to work on today. You feel the
Oh,
ankle?
Yes.
Yes.
Ouch. Yeah.
Hi. We're saying left knee, yes?
Yes.
I'm going to start on right ankle.
Okay.
And the reason why is you've been compensating on right ankle.
Yes.
And I'm going to pull on the right ankle, but I'm going to use the board for the left one because we don't want to disrupt that knee.
Okay.
Okie dokie?
All right.
Alrighty. Alright, let's see. So, starting with lotion, you can use oil, shea butter, whatever you want. And we're just working out some of this periarticular swelling. Work towards the heart. Okay, up 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3. It's an AS talus medial tilt is what it is. I'm being a little nice today. Not too nice, but all right. Now, passive range of motion. As I'm dorsiflexing, I'm applying pressure A to P on the dome of the talus with my web contact to equalize the pressure of the joint. More on the medial side, that's where the fixation is. And let's set it now. Good. Lottie, Daddy, da. Adria.
Oh.
Gotcha. Now we're going to use the board. AS talus, medial tilt. Posterior fit. Hi. Raise your left leg. I just want to put some thing there to stabilize it. You okay there?
Yes.
Gotcha. Okay, my dear. Let's stand up slowly. Turn to the side, please. Take your time. I'm going to help you up. 1, 2. Awesome. Give it a second. Deep breathing.
Whew.
How was that for you?
Good.
Not bad, right?
Not bad. I can take the pain.
Hopefully it's not too bad though. It's not.
No, it's not too bad.
Okay. Now let's see. Okay. You're gonna walk once first with the stick, and then you're gonna put the stick down, okay?
Okay.
Let me hold on. There you go.
Ooh.
Ooh.
Oh
Look at
my
this.
God. This leg, it feels light. Like I can, when I don't know. I
Just enjoy it. Walk
Yes.
and let's enjoy. It's lighter, it's moving a little smoother.
Yeah.
Okay. Now, what I'd like you to do, you can use your stick or the wall, raise your left leg and just stand on your right leg for a second.
Say that again.
Hold on to the wall, raise your left knee. Hold, keep it up. Because this is homework.
Oh, okay.
Okay. Now just to see, can you raise your right knee? I just want to see. Right.
Yeah.
How's the pain in the knee?
The knee, I don't feel the pain
on.
as much.
Raise the right. No. It's the, no. Raise the right.
The knee, I don't feel
Keep
the.
it up, please.
I don't feel the pain on my knee, but it's just.
And the
that
glute.
push. Yeah.
That's the pain in your butt.
Yeah.
We'll deal with that. Don't worry about it.
Okay.
All right, we'll deal with that. Awesome. Have a seat, please. Right over here.
Oh my gosh.
Visit number
2. Whew.
Very good.
My foot, my ankle feels a lot better.
Now, I'm just getting things moving, okay? So 5, 4, 3, 2, 1. Move your hand, please. There you go. With a buff and polish. Let's get that pain in your butt. You okay with what I'm doing, right?
Yeah.
5, 4, 3, 2, 5, 4, 3, 2, 1. All right, my dear. We're all good for today.
Okay.
You get your knee x-rays
Yeah.
today. Tomorrow we're going to go over those.
Okay.
Okay? And then let's see where we're at.
All right.
All right,
Thank
my
you
dear.
so much.
Questions?
No,
We're good?
I'm good.